So I am a registered massage therapist, but there are extra courses that I took and extra therapies that I do. One is called craniosacral therapy. It works on the membrane surrounding the brain and spinal cord, using the bones as handles to alleviate any tensions or torsions that there might be around the brain and spinal cord. And another one is a visceral manipulation. So it works on the organs and their sliding, gliding relationships, and how through illness, injury, dehydration, and stress, they can be restricted and perhaps make a restriction in a joint.
It sounds amazing, and I know we're going to dive deeper into that during this segment. How did you get into this type of therapy?
So first of all, my first background, I was a competitive gymnastic coach and fitness instructor.
Wow.
And found that I had a deeper need to learn more.
Okay.
I went to school for massage therapy. While I was there, we had teachers that some of our teachers did do craniosacral therapy. I started taking some of those courses after graduating, and it delved, it went deeper and deeper and deeper, and found that you could help more and more and more people.
Yeah, and it's exciting because when you did that, was there something in you that kind of said, the training that I have is great, but I need something more, or did something kind of pull you in this direction? Because I think there's only some people do what you do, but not a lot of massage therapists do what you do.
So there are some massage therapists in the area that do some of these techniques. I'm the only massage therapist who've done all of the whole program of the visceral manipulation course.
Okay.
So they can work on some organs, but not all of them. Each layer leads you to the next layer. You go in and you treat and you explore and find more, and your hands tell you more, but your hands say, "Oh, I can feel that there's something there, but I don't quite have a technique for it yet. So I need to go to another class."
So with the visceral manipulation, what would you use it for? Is it good for headaches, migraines, body pain? Or you can go a little bit deeper in for me just to explain what it actually does.
It can be used for a huge variety of reasons. It can be used for headaches, but sometimes you find that the headache comes from a very, very different reason. So I had one lady who had these crushing headaches for 4 years after a car accident, and she'd had extensive therapy done on her and no relief. And so what we did is I went exploring with my hand, trying to find out where is your problem actually coming from. This is the result, is the headache in your head, but where is the problem coming from? And what we found with her was we needed the combination of craniosacral therapy working on, so can I show you?
Sure can, yeah. So we're just going to... You just want to hold it up right there. That's perfect.
That's the bone of the sacrum.
Okay, and for those that don't know, where's the sacrum located?
So that's your tailbone. It's the triangular bone near your bottom of your spine. So for that lady in particular, we were looking at the membrane that surrounds the brain and spinal cord goes all through this up.
Okay. Yeah.
So what we found with her is there was a restriction in her uterus that set in front.
I see.
That was pulling on her sacrum, that was creating the tension all the way up to her head. So by not working on her head, we alleviated her pain. And actually, I phoned her a couple of days later and said, "How are you?" I was a little bit, we had done a lot of work, I was a little bit worried. So I found that she said, "Well, I sat in my car for 10 minutes afterward wondering what was different.
Okay.
And I realized I had no headache. For the first time in 4 years.
I guess, too, living with headaches, and myself included, I've lived with migraines most of my life and things like that. And you do, because a lot of times for most people, the simplest thing is you can't handle the pain, so it's to open up your medicine cabinet and grab something that you think will alleviate it. But with your system that you do, it gives you an alternative,
Yes.
you know, as well, that you can no longer have a headache. But like you said, your headache's not necessarily in your head.
Right.
You know, it can be somewhere else in the body and stuff like that. Like, I'm very intrigued with this therapy, kind of how it works, and you're showing the alignments. I know you have some other little pieces here.
Yes.
So if we can go through, maybe if you pick another one and just kind of
Yes.
explain why you brought it to us today.
Okay. So this bone is called the occiput, and your brain stem comes through here.
Okay, so where would it,
So it would
I just want to
sit-
make sure, yeah.
It would sit kind of like this,
Okay,
and then this bone is called the sphenoid bone,
okay.
and it sits behind the eyes,
Oh,
and it
okay.
attaches in here. So the craniosacral rhythm, it has a rhythm like a heart rate or a respiratory rate, and it is very slow and very small. I'm going
Okay.
faster and larger for visual purposes for you,
Okay.
but they have a rhythm like this. But say
So these would actually move inside
this
your
would
body?
move inside
Oh,
your, yes.
okay, so it's not solid.
With the flow of cerebral spinal fluid, the fluid
okay.
that your brain floats in, it has a rhythm.
Okay.
Okay, and then this membrane
Mm-hmm.
sits inside, and the fluid is inside the membrane.
Okay.
So this little piece here,
It's
It's
right there.
right-
So this
it's right
would
here.
flow through,
this would
and
be
it'd all be connected.
this would be like this. So
Okay.
when this movement happens, this kind of engorges with fluid and
Okay.
then dissipates and engorges
Yes.
with fluid, and then this one down at the other end would move with that.
Oh, okay. Wow. And I mean, I thought the body's just solid, that the only movement you do is when you, like, lift your arms or do this or things like that. I mean, I guess there's lots of inner working parts that we don't realize that are actually moving and things like that, or the fluid that moving. Because I guess a lot of people just think, you know, oh, I just have blood in my system and it's just blood pumping
Right.
through my veins,
Right.
and that's it. You
So
know.
some people after an epidural may have a little bit of scar tissue on that dural tube,
Oh. Okay.
and then that can sometimes cause these flash migraines. When they try to stretch, they get this huge headache.
Okay.
So we use the bones as handles to stretch those membranes and get rid of the adhesion,
Okay.
and so there's more flexibility and movability in it, so they don't have that tension.
Okay, so would that work the same for maybe other types of headache, maybe a sinus headache or a regular headache or a migraine, or like somebody that gets it like right in behind the eyes?
So that
You know.
that is sometimes that the sphenoid bone might be sitting a little bit off to the side
Okay.
or twisted.
I see.
And then you also have your motor nerves and your optic nerve run through this bone. So it can play on your eyesight as well. So it's very, very integrative. So between the bones themselves and then the organ relation to them, if a organ is sitting in the wrong spot and adhered in the wrong
Okay.
spot, then you work on the organ to release the tension. Then that releases the tension on.
Okay.
I had one lady that I worked on scar tissue from a hysterectomy in the abdomen,
Okay.
and she was able to regain eyesight. Now she wasn't blind, but she was.
But it was like
she was
a
getting
blurred
better
vision
and better,
or
and
a-
she kept on going back to her eye doctor and reducing her prescription
I see. Oh,
week after week, about 5 weeks in a row.
Wow. Because I guess the doctor was probably pretty amazed and thinking, what's going on here?
Yes.
You know, because normally for most people that wear glasses, they always tell you it's going to be more progressive, and the more you wear them, then you're going to have to get a stronger pair,
Yes.
then a bifocal, and then you know, it just kind of keeps going on and on and on. So it's nice to see that there's a therapy that's good for, you know, other things as well. So what about, I have a little list here of just a couple of things, because some other stuff is like frozen shoulder,
Yes.
bladder issues, fertility issues,
Yes.
even depression.
Yes. So they call it, in craniosacral therapy, they call it the unhappy triad.
Okay.
So these two bones
Okay.
would be stuck together and not able to
Oh, they're not
slide and
flexible.
glide.
Okay.
Then where on the bottom of this bone you can see two little spots here. That's where your skull sits on your first vertebrae
So would
of your
that be
spine.
in? So would that be in?
So this one is
around
here.
Okay, so this is
and
this
this
stuff
one
here?
is here.
Oh, okay.
And these
Right, your
two are
occipital?
inside your head.
Mm-hmm.
And this one is where the bone sits, right on your first vertebrae, on your spine.
Oh.
So these two would be stuck, these two would be stuck, and where the last lumbar vertebrae sits here would be stuck.
Oh, okay.
So
yes.
which doesn't allow for that flow of movement, for that pumping of cerebrospinal fluid.
Oh, okay. So if the fluid isn't pumping properly, what can result from that?
A huge variety of things. There's some work being done with Alzheimer's and this and these techniques.
So they think it's connected, or they think
they do think there is some connection.
Okay.
There are other connections as well, but some of those. So I use an integrative approach between the craniosacral therapy and then the visceral manipulation working on the organs.
Okay. Yeah.
So for the frozen shoulder, for example, if the liver has ligament, if it doesn't have full mobility of the liver, you can't have full mobility of your right shoulder.
Oh.
So if it's possible to see, so the liver's a large organ.
Okay, yes.
So if we do this little twisting motion, you can see that has an effect.
Yeah, you can see it aligns right up.
A variety of places, and it actually goes to the back as well.
Oh, okay.
So what I do is we find, where is your frozen shoulder coming from? We check the liver.
Okay.
If it's coming from there, we treat the liver. Then we allow the frozen shoulder.
Okay.
So what I do is just put the body in an environment that it can self-heal.
Okay. Yes, that's amazing. So yeah, one thing I have on the sheet here is fertility, because we've had some other segments where we've dealt with infertility. So with your practice, how can you assist in that?
We are very good in assisting people where their labs are really good and they don't know why the people aren't getting pregnant.
Yes.
And that is about making sure that the uterus and fallopian tubes have full movement, so that it can go and grab the ovary. And go grab the egg from the ovary. If the uterus isn't sitting in the right position, if it's stuck forward, it can't reach and grab far enough.
So is that a big issue normally with infertility, that because it's not flexible and it's not moving, it doesn't have the ability to grab and bring in and process? Absolutely.
And then the other thing that we learned was that endometriosis happens due to the uterus being stuck, or the fallopian tubes being stuck in the open position. So we allow for more mobility so that they can lie flat down, so that those endometrial cells are not going up into the abdomen.
Wow. I mean, there's just so much. I mean, you're so thorough. You're so knowledgeable. I'm just blown away right now. Like, I'm so excited you're here. You don't know. And say, we go back to, say, with depression and things like that, because I think there's quite a few people that suffer from depression or mild depression or don't even know they have depression. So you said before that it's kind of, this is locked in the front, so you know the term?
So this membrane that goes all the way down and attaches down here, right? If it doesn't have the ability to pump and flow, it isn't getting the nutrients all the way down, all the way up, and it's clamping down on your brain. And it doesn't have full expression and full mobility.
Because it makes total sense, because a lot of people think, I'm just having a blue day. I'm just having, that sort of thing. And I guess we all have ups and downs and things like that. But when it becomes a more chronic issue, I think for a lot of people it's tougher. So if someone were to come and see you, what's the normal process you would take them through? So if they're doing the visceral, then if they came to you, so if I came to you for an appointment, how just a quick overview of what it would be like, or what my experience could be like.
So you tell me what therapy you're interested in coming in. Truly, I integrate them all.
Okay, yeah.
But what I do is I do an assessment. I take a look at how you move, how you walk, where you're not moving. So let's say I had somebody yesterday, when they walked, one arm went way over and the other arm barely. And they had a restriction going across
Yeah, because
this
they're
direction, right?
Would that also make a difference for a lot of people too? They have like rolled in shoulders and things like that, that they're not.
Yes.
Or as I say, they're hunched over, or their neck is hunched over, and they've got, like, you see a lot of that as well.
Yes.
Or I guess they're not in, I say, necessary alignment, or the head is above the shoulders above the hips.
Yes.
You know, things like that, and you know, just aligned and that sort of thing.
So we see where they're moving, where they're not moving, and then we take a listen with the hand.
Oh, okay.
Okay, the hand has 3 spots that it can pick up infrared.
Yes.
And so we feel for where those are, and then whatever we find is the hottest, we go for.
Oh, awesome. So going back to massage, you do some interesting things with classes. Can you touch on that a little bit?
Certainly. I do have classes that I teach. One is for siblings, one is for parent-child, and one is for couples to help improve the relationships. So people who are in each other's space a little more.
Oh, okay, yes.
Massage helps increase your happy hormones and decrease your stress hormones. So the class is called Deepening Connections, and it's through using your body language, using being nonverbal as much as possible, and being able to be in each other's space and being present for the other person. And using massage techniques, of course, to learn how to decrease fighting and help deepen your connection in your relationship.
Yes. So as we come to a close, I see you have one more item here on the table.
Yes.
So if you want to just go over that briefly.
Certainly. So we all have these energy fields. Okay. Okay. So this is a toy I found, and if we close the circuit, we can make it go off, right?
I love that.
So if I hold one and you hold one, it doesn't go off because we haven't closed the circuit.
That's so cool.
We haven't closed the circuit. So we feel these energy fields. So if we're in each other's presence and one person's upset and the other person isn't, then it can affect us. So I just want to show you about your presence of being.
Wow, that's so amazing, Eileen. I'm so glad you joined us today. You brought such amazing things. I want to say thank you for coming, and I want to say thank you for joining us for this segment, and we'll be right back after the break.